What is the primary complication of osteoporosis? Fractures. What is the major reason for regular estrogen and progesterone doses in menopausal women? To prevent osteoporosis. How can osteoporosis be prevented? Optimal calcium intake, estrogen replacement. What causes gout? Overproduction of uric acid. What food should a client with gout avoid? Purine-rich foods. How does weight loss help with gout? Weight loss decreases uric acid levels and decreases stress on joints. Why is colchicine effective for gout? It decreases inflammation. How does increasing fluids help with gout? Increased excretion of uric acid. What is the major side effect of aspirin? Hearing loss. What is the most common form of arthritis? Osteoarthritis. What is the difference between osteoarthritis and rheumatoid arthritis? Osteoarthritis is localized. Rheumatoid arthritis is systemic. What are the typical symptoms of compartment syndrome? Unable to perform active movement, pain with passive movement. What causes compartment syndrome? Edema or bleeding into the muscles to a point of cutting circulation. How long would it take for tissue death to occur in compartment syndrome? 6 to 8 hours. What is the surgical treatment for compartment syndrome? Fasciotomy. What is the early sign of compartment syndrome? Paresthesia. What are the signs of a fracture? Redness, warmth, pain. What is involved in a neurovascular assessment? Nerve and blood supply to the area. What does a foul odor from a cast indicate? Possible sign of infection. How do you reduce roughness of a cast? Petal the edges. How do you reduce swelling in a limb with a cast? By elevating the limb. Why is it contraindicated to get a cast wet? A wet cast will break easy. Describe fracture pain. Sharp pain, worst with movement. What are the classic fractures occurring from trauma? Humerus and clavicle fractures. What is meant by closed fracture? Intact skin over fracture. What is the purpose of traction? To prevent further trauma and overcome muscle spasms. What fractures commonly occur in Paget's disease? Transverse fractures. What are the most serious complications of long bone fractures? Fat emboli, hemorrhage. What are the signs and symptoms of a fat emboli? Petechiae on the chest, tachypnea, tachycardia, shortness of breath. What is the treatment for a fat emboli? Oxygen, IV fluids, steroids. How much weight is commonly applied to box traction for adults? 5 pounds. How is vitamin D important in the healing of fractures? Vitamin D increases absorption and use of calcium and phosphorus. What is the best position of the hips after surgical hip repair? Abduction. What is the purpose of pneumatic compression boots after hip surgery? To prevent deep vein thrombosis. How do you handle a wet cast? With the palms of your hands. Why should a client with a hip spica cast avoid gas-forming foods? To prevent abdominal distension. What is the most effective way to prevent sports-related injuries? Warming up before activity. What would you notice about the leg on the affected side of a hip dislocation? Adducted, internally rotated, shortened. What is the most common cause of osteomyelitis? Trauma. In musculoskeletal injury, how does cold therapy decrease pain? By causing vasoconstriction, it prevents edema and muscle spasms. What are the signs of infection in a person with a cast? Fever, foul odor, hot spots. What food choices would a client on Coumadin limit? Green leafy vegetables.